Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us for our weekly update press conference on the status of Delaware's response to COVID-19 here in our state. I'm joined again by the Director of the Division of Public Health, Dr. Carol Rattay, and by A.J. Shaw, who's the Director of the Delaware Emergency Management Agency, both of whom are working hard with their teams to address the conditions on the ground in our state, doing a tremendous job. We continue to thank them and all the public health and emergency response personnel across our state, and they're just teams of people at the local level that are working hard every day to control the spread of COVID-19 in our state, to do the testing, to respond now to those who test positive with our contact tracing contract, which is in effect, and those contact tracers are working, and the metrics that I've seen so far, the calls that have been returned and the conversations that they've had have been, I think, at a rate that's as good as there is, maybe across the country, providing really good information in addition to the identification of individuals who've come in contact with those who've tested positive so that they can get tested themselves. Also good information about where they might have caught the virus in terms of that interview, whether it's maybe in the beach community or in some of the small town communities in Sussex County where we've seen a lot of viral spread going back to the poultry industry outbreak that we had a couple months ago, and lots of scenarios in Kent County and Sussex County as well. It does provide us with information as we continue to make decisions on whether to open parts of our economy and whether to allow certain kinds of gatherings, and just to provide the kind of information that's necessary and helpful in making those really difficult calls. A lot of work is going into the question of how to open Delaware schools. We've had great work by the working group committee that was put together representing school districts and various interest teachers and parents and the like, public health officials. We'll talk a little bit more about that, and we continue to work on that and get a lot of feedback from elected officials, legislators, members of the public, and we encourage you, particularly parents, to engage, to ask questions, particularly those that relate to the health of the community, because our approach will be based on 3 scenarios rooted in the amount of COVID-19 spread that we're seeing across the state of Delaware that will make it safe for school districts to move forward in opening the schools. And at some level, that ought to be our objective. We'll talk about that in a minute. So first, let's look at the data for today and this week. In total, we've got 13,000 total positive cases of COVID-19 since the beginning, back in first cases reported within the small group of professors and science-based personnel at the University of Delaware back in early March. 144,000, almost 145,000 negative tests, so we're really ramping up the tests. I think on average 15,000 tests per week. Not quite to our goal yet, but we're pushing that hard. A lot of that depends on interest that we can get among people, particularly who aren't symptomatic, and we have a lot of folks that do not have symptoms, but that are shedding the virus, that are positive, if you will. And so we need to get a broad reach of folks that are availing themselves of their to a test, and AJ will talk about that a little bit later. I want to thank AJ again for his leadership of that team, partnership with Newcastle County and cases up here. I appreciate that. 525 total deaths, as I've said all along, just a precious life, every one. We have a chart, though, that shows how that has really leveled off, which is a very positive thing, obviously, and for family members whose seniors are mostly at risk there. We're doing a better job in nursing homes and other facilities for the elderly. 58 current hospitalizations, up a little bit. We had moved down below 50, still comfortably within our ability to accommodate. Only 11 critical hospitalizations, and you'll remember that back in April we were at a peak of 337 hospitalizations, and of course many more that were critical. And even at that level, 337, we were maybe only about halfway, a little over half to our total hospital capacity in a surge type of situation. So comfortably under that now. How do the cases break down? There we go. This is a measure that we continue to look at, and we'll look at as public health develops the gating criteria for the opening of schools, for the green, yellow, red phases that we're looking at in that reopening. Green meaning fully reopening, yellow meaning a hybrid of partially remote learning and some in-person instruction, and then red meaning all remote learning. So 105 new cases per day, that's a 5-day moving average. Our target there is to be under 10 per 100,000, roughly 97 cases per day. The target on percent positive, we're good there, under 5%, which is the World Health Organization target. And that gives you some idea of, that's our condition today over the last 5 days with that moving average. Gives you an idea of where we are as it relates to school reopening criterion, solidly in the middle of the range, or in the yellow category, with which would bring us a hybrid kind of reopening. So in terms of positive cases, just over 6,000 in Newcastle County. Like to see those percent positives and those daily case numbers being below the indices from the last chart. So at 5% positive, they currently are below 5% positive. AJ shaking his head, which puts them at about 50 some cases per day as our target. So we'd like to be well under there. 2,000 positive cases for Kent County. Again, pretty steady there. There's been a little bit of an uptick in Kent County, and then 5,300, almost 5,400 positive cases in Sussex County. It continues to be the area where we've had the largest outbreak, first among poultry workers in those communities, and then at the beaches. We've settled down a little bit in terms of the number of new positive cases each day in beach testings. We've got a big beach testing site today out at Epworth Church, so if you haven't signed up and you're watching and you want to get a test, they'll probably have some tests out there for you, although today we've had a few more minutes. Sorry, AJ, better hurry up. We continue to focus on the condition there. And then the breakdown in terms of the positive cases by age, not a lot changing there. Again, we increasingly see a larger number in the ages 18 to 34, young adult category, particularly in at the beaches, in the hospitalization industries. Very consistent with what we're seeing across the country by the reports from the governors of Florida, Texas, and Arizona on our White House call yesterday. Some really helpful information about the experience of each of those states. And again, seeing a lot of new cases in that young adult category. About the same, a little bit of an uptick in the 18 to 34 category in terms of rate of cases by age, but not a significant change there. On the data dashboard with respect to personal protective equipment, we still have all the vessels completely full, and so we're good there. There is some concern that was articulated on the White House call about states experiencing supply chain limitations in personal protective equipment, and in particular the turnaround for testing results for the private labs. We've seen a little bit of that with respect to testing results with private labs here in Delaware. Most of our testing, though, our turnaround time, AJ, is about 36 hours, is it?
Correct. So for the state-sponsored sites that we're using the saliva tests for, about 95% of the individuals are getting their results back to them about 36 to 48 hours from the time they have the test. So if you go right in the morning at 9 o'clock, it's going to be a little longer than the ones in the afternoon. But we are averaging 99% of those are getting turned around and within 24 hours once they get to the lab. So knock on wood, still much better than we're seeing in some of the commercial labs right now. But I think as we see multiple states kind of increase cases, we're going to see another slowdown with some of the lab turnaround time. So we try to diversify the methods we use and the labs we use to make sure we don't put too much burden on any one source.
Yes, so there has been some in other states experiencing a delay there in getting their tests turned around. There is some concern as we go back to school whether there will be adequate personal protective equipment. So while we don't see any challenge here at the moment, we're keeping our eye on that dashboard as well. In terms of our overall dashboard, here's what we look at each day and certainly each week in our update here in this press conference. And you can see on the top side, the far left and the middle graph are current hospitalizations. That is the number of people in the hospital, as I mentioned earlier, in the mid-50s today. And then the new hospital admissions each day, which you can see is a little bit up and down. And we've got a little bit of an uptick over the last couple days. Something that hospitalizations themselves is a little bit of a lagging indicator. We are looking at how to incorporate this into our opening data set because it does give us an indication of the severity of the illness. If we're seeing more cases, but not a lot of hospitalizations, meaning people that need additional care, then we know the severity is not at a level that would cause us a concern. Again, at the peak, we had 337 people in Delaware hospitalized, and we're getting a larger number, obviously, on a day-to-day basis. On the top far right is the percentage of persons who are tested positive. Well, the target for us there is to be below the World Health Organization target of 5% positive. We are below that and have been for the last several days, if not a week, and that's a good thing. Had a little bit of an uptick there yesterday, but that was because we had so many test results turned in, several thousand from a few days ago, because the percent positive was around 4.4%, and so you really have to look at that. I really believe strongly at those two measures together, the percent positive and the new positive cases, which is in the bottom row far left. You can see the little uptick there with the orange line as of yesterday, July 20th. But the fairly flat, a little bit on the upswing, new positive cases. Again, we want to keep those under 97 so that we can stay below the target of 10 cases per 100,000. So 97 is the target on a day-to-day basis and 5% positive. Obviously, the more tests that we do, as long as you keep that percent positive under 5%, you're going to end up going over a 97, particularly if you've got a couple thousand that you're doing and coming in. And that's why it causes us some concern when people in other states just look at one or the other of those. We don't think that's good science. So the last two are just the cumulative cases going back to early March. You can see that on the bottom far right. And then just emergency department visits by influenza symptoms and COVID-like symptoms, peaking there just before our peak in terms of number of cases, and then leveling off with a little bit of an uptick. So if you take the 90-day view, you can see the outbreak, the COVID-19 outbreak in our state in terms of current hospitalizations. Now starting there at a date in April, which is right near the peak, and then very dramatically going down. New hospitalizations, admissions, of course, is up and down, as I've said, but clearly at the end of April, beginning in May, you had the real peak. A percentage of persons who tested positive, again, the peak back in late April. Same with new positive cases, with a little uptick there with the beach outbreak in mid-June. And we hopefully are on the other side of that and trying to push that down. So it gives a really good picture of where we've been. And then as we look to the fall and the reopening of the schools, we're looking for continuing flattening where we are today, which would put us in the yellow scenario, and increased flattening which would move us into the green light for as much in-person instruction as possible. My own view is that we're likely to be in that yellow category as we move into the end of August, early September, based on where we are today, where we've been, and our trajectory going forward, our increased number of testing. I don't see right ahead of us any particular situation like the reopening in phase 1 and phase 2 that we had, like the start of the summer and the beach season celebrations in the bars and restaurants coming up towards the end of the fall. There is obviously the Labor Day weekend and the like, and then of course more activity beyond that as we do try to open the schools in a hybrid kind of way. So here shows the percentage of persons who tested positive since the end of March. You see the peak again at the end of April. Again, remembering back in those earlier days, we weren't doing nearly the number of tests, so the denominator in that fraction was much lower than it is today. And so that does exaggerate that peak, which was at 43% positive. You compare 43% positive to our target of 5% positive, which we are under at the moment. And you can see that we've flattened the curve and we're moving forward. In terms of lives lost, you look at other states around us, New Jersey and New York, which had the most lives lost in total. We did have a pretty steep increase when we had the peak of the outbreak of COVID-19 here in our state. But since then, since mid-May, the number of deaths has really flattened out. Every life is a precious one for sure, particularly if it's a family member of yours. But this does give you an idea of how our response has improved, particularly protecting those that are in nursing homes and senior citizens, keeping the spread by testing, isolation. It also is an indication of the fact that we freed up quite a bit of capacity now in the hospitals. Our hospital occupancy now for COVID-19 is in the mid-50s. We'd like it to be below that and continue to work on all of that. So if you look at this chart, this gives you an idea which states are meeting the positivity test of 5%. Delaware's just on the good side of the line there in the middle, with the green states from Delaware to Connecticut and several of those states in between. And then two states around us, Maryland and Pennsylvania, which were just slightly above that break point at 5% and going all the way up to Arizona and then Puerto Rico at the end, that have the most positive testing positive, percent positives above 5%. So the World Health Organization, this is a criteria, an indicator identified by the World Health Organization at 5% positive. We have a very high testing rate per million people, which is also a very positive thing in terms of the way we're managing the situation. So again, looking forward to the fall and school reopening. You'll remember from our press conference last week that the task force, the working group that consisted of lots of folks across with interest in schools and involvement in schools, from teachers to administrators to parents, developed an approach that we're asking school districts to look at, depending on the health of the community, the extent, if you will, of COVID-19 spread in the community, starting with scenario 1, which would be the green scenario, which is minimal community spread. We're looking right now to identify the exact metrics, the numerical metrics, that would provide the gateway to the green scenario, minimal community spread, but certainly below where we are now at 5% positive, 97 cases a day, looking more like 97 or 100 cases per week, and maybe half of that or thereabouts on the percent positive, just to give you an indication, starting with a criteria established by organizations like the World Health Organization. It would be helpful, more helpful certainly, if we had a recommendation about those criteria to identify community spread by the Centers for Disease Control, but we have not received such guidance yet. It may be forthcoming. That would be helpful. So in the yellow category, scenario number 2, minimal to moderate community spread, which would include remote learning, children who are learning from home, virtually, if you will, through high-speed internet and devices, to in-person learning in front of teachers in schools. And we'll talk a little bit about that. And we ought to think about it in this terms. Our goal ought to be to have the biggest benefit for the most students with a manageable or lowest amount of risk. And this 3-scenario approach gives us indicators based on the science and the spread on the ground to give us a measure of that safety. You have to overlay on top of that, operational requirements that were in the report to each of the school districts about spacing of students, number of students in a classroom, transportation, bus transportation, which is a challenge and one that districts are looking at, how many teachers you need given the number of students, how they're aligned in desks in their classrooms, when you're going to do the cleaning and sanitizing of the facility. So lots of operational questions, and I know the districts, we've been in touch with several of them, are working hard to identify those, mostly to accommodate, obviously, students that would be coming for in-person instruction, either in scenario number 1 or scenario number 2. We do have quite a bit of information and about who should be prioritized. Here's a study from the National Academies of Science, Engineering, and Medicine that really recommends focusing on elementary school grades. And when you think about it, it kind of makes sense in weighing the risks and benefits. The students, the children in kindergarten through grades 5, first are least likely to catch the virus, and those who do don't get seriously ill based on the experience that we've seen, and that's been documented. They could be transmitters of that virus, and obviously that's a current concern. They're probably the students that need that in-person instruction kind of more than the rest. They're learning to read. One of our primary goals in education for Delaware is to make sure that every student can learn at grade level at grade 3. And so kindergarten, preschool through grade 3 are critical for those students to learn how to read. You learn to read from preschool to grade 3, and then you read to learn from grades 4 on. So if you're not reading on grade level at grade 3, you're going to have trouble beyond that. And so the idea of students that are now find themselves in those elementary school years and they're not able to get that training and learning how to read, I think can be significantly negatively affected in terms of their academic career. So a way maybe to think about a hybrid model focusing on the earlier grades for in-school instruction. And I'm sure the districts will have lots of ideas about how to do it and different hybrid approaches to it. We also, in thinking through that, know that schools provide more than education, and we have learned that through the spring. We feed thousands of students across Delaware every day with school breakfasts and school lunches. And the school districts did a really, really good job in making sure those students got their school meals delivered at curbside at schools in most cases, delivered to homes in some cases. I think we even had a period where we had our National Guard helping us with that. AJ shaking his head. Yes, and so we know that that's the case. And I think probably more importantly than ever, students, particularly with our effort in cooperation with a number of members of the General Assembly and, of course, the education community, to provide mental health services and to help students deal with trauma that's affecting their ability to learn. They get those services in schools as well. God knows that we've all experienced trauma over the last 4 months and are in need of those services, and so the children get those services at school as well. They get socialization, the idea of how to interact with their peers, other children, with adults. And most people don't think about it this way, and we certainly don't when it comes to educating children. But children is childcare, or school, is childcare or daycare for lots of parents who go to work every day. And as parents go back to work, and increasingly more parents will, they'll need a place for their children to be, and school is an important part of that, particularly for the younger children. We also learned last spring that when lots of folks wanted to close down the daycares, we needed to keep some number of them open. I think we kept about half open for essential workers. Otherwise, nurses and other frontline workers couldn't go to school. And so we do know that we can do that, and do that in a safe way. And lots of other additional supports that go into the equation as well. To help the school districts work through some of these issues and make sure that the environments to which we're bringing back some of our children to school, either in the green scenario or under the yellow, most likely under the yellow scenario, we're assigning one of our public health experts to act as a liaison with each school district to advise them on some of these decisions that really go around operational logistics, how to set up school desks, how to move children from room to room, how to feed children safely, how to move children to and from buses and on buses. Lots of very important things that need to be discussed. Finally, I just want to thank unbelievable job by so many people across our state. Our National Guardsmen and women who helped us with so many. Our Delaware Psychiatric Center at a very difficult time. They've helped us with feeding school children. They've helped us with contact tracing. You name it. Whenever we've needed their help, General Mike Barry and his team have stepped up to the plate, and our citizen soldiers, men and women, have done an incredible job. As I said, they helped us set up our contact tracing until we got our contract with our outside firm fully in place, and we are now. DEMA and all the first responders, just an incredible job they've done and continue to do. Law enforcement, emergency, ambulance, and emergency medical techs, our paramedics, frontline to healthcare workers, our hospitals, now all the Corps that's working on our testing sites. That includes all those first responders I just mentioned, personnel from Newcastle County and paramedics, just doing a tremendous job, and you can see we've had great results. We've flattened the curve considerably. We've responded, I think, effectively to 2 outbreaks, one among the workers in the poultry industry, and 2 with the young adult groups in the hospitality industry along the beaches. We're hoping that we don't have other many outbreaks like that, but we have corps of folks that are willing and ready to respond with the leadership of Dr. Rattay and her team at Public Health, and A.J. Shaw and his team, both at DEMA at the state level and our local partners, and so much can be said to our Army and Air National Guard. So Dr. Rattay?
Great, thank you so much, Governor. So I would like to start today by talking about some of the community-based efforts that is underway with a number of partners across our state. I first want to talk a little bit about Healthy Communities Delaware, which some people are aware of, others aren't, but it's the result of years of work focused on addressing the root causes of health inequities in our communities, knowing that health is determined more than just from healthcare access, but by where and how we live, learn, work, play, and pray. So Healthy Communities Delaware is an initiative that is focused on alignment and investment and impact. Alignment, because although there's a lot of individuals that care about communities and want to work in communities, we know that collectively we have a greater impact if we are all focused on the same goals. Investment, because there's a lot of investment that takes place in communities, but often it's not always aligned, and there's great opportunity to leverage investment. And all of this is to really focus on having a greater impact on communities. So the goal with Healthy Communities Delaware is to improve the health and well-being and equity in low-wealth Delaware communities. And it really is a collaboration of many, many partners. The managing partners include Rita Landgraf at the University of Delaware, who leads the Partnership for Healthy Communities, Stuart Comstock-Gay, who is the CEO of the Delaware Community Foundation, and for the state of Delaware, I am our lead managing partner. So our 3 entities have been working together now for several years. We have a leadership council that involves many, many partners across many sectors, and that includes state, local, and county government. Additionally, we have an investment council, which includes a number of investors like banks and hospitals and charitable organizations and others. And very importantly, or most importantly, are our community partners. Our guiding principles are collaboration with the community, so putting the community in the driver's seat and really having them identify what are their most important social determinants of health. Embedding equity, so really looking at what is impacting lower health in our communities. Mobilizing across sectors involves more than just healthcare, as we've talked about, but really bringing, whether it's housing or jobs, education, the many different sectors that impact health together at the same table to be mobilized, and also focusing on community prosperity. So again, that includes the economics and jobs and financial security in our communities. And most important is committing to this work over the long term. So we have been doing this work for some time, and in fact we'd begun to work with our community partners when this pandemic began. And as I think we've all seen, that this pandemic has a disproportionate impact on our low-income Black and Brown communities and communities where we have high numbers of non-English speakers. There's a number of reasons why COVID-19 has a greater impact on some of these communities, which includes, the economic impact of this pandemic certainly has been devastating to many communities. But we also have in some of these communities many of our essential workers, as well as living conditions that can be more challenging. Certainly a higher burden of the chronic conditions that are having, where we're seeing the greater health consequences, and even health care access can be more of a challenge in some of these communities. So we're focused now, we've asked our community partners to reshape or expand the scope of their focus to address COVID-19 by ensuring that in our communities there's an equitable response to COVID-19 that not just includes, prevention and testing and easy isolation and quarantine when needed, as well as access to care, but also addresses the social determinants of health that are impacted by COVID-19. So whether it's housing instability or jobs or other economic impacts, in addition to basic needs such as food and nutrition services. Our communities have been identified, and this occurred over a year ago, by using what we called a health index score, which used a combination of life expectancy, infant mortality, educational attainment, and child poverty. And so we have been working with the top quartile of those communities in Delaware for some time now. And so on the next slide, we have we're really getting into our announcement, which is that we're really excited to be funding our opportunity communities, a number of our opportunity communities, to address the impact of COVID-19. I want to give a huge shout out to some of our amazing teammates, Kate DuPont Phillips, who's at the University of Delaware and Delaware Community Foundation, as is Brian Raymer, and from Public Health, Lisa Henry and Laura Saperstein, who have worked really hard with our communities to get these contracts in place. I also really want to thank the governor and the General Assembly and the Health Fund for bringing these funds to bear to help support these communities. With this announcement, 9 communities are receiving funding through 12 separate community-based organizations. But I want to also make it clear that in each of these communities, it really is a collaboration or a partnership amongst many, many partners in the communities to work together. So in Newcastle County, we have Westside Wilmington, and the funding is going to Cornerstone West Community Development Corporation. In Westside Wilmington, the recipient is Be Ready Community Development Corporation. In Northwest Wilmington, it's Jefferson Street Center. In Eastside Wilmington, it's the Habitat for Humanity, Newcastle County. Also in Eastside, Central Baptist CDC. In Southbridge, it's the South Wilmington Planning Network. Route 9 Corridor, it's the Route 9 Master Plan Monitoring Committee. And also in Wilmington is LACC, Latin American Community Center. In Kent County, we have Dover and Western Kent County, which is being supported by NCAL. And in Sussex County, we have in Western Sussex and Georgetown, the Food Bank of Delaware. In Western Sussex and Georgetown, also La Esperanza. And in Ellendale, the Southeast Rural Community Assistance Project. And these teams have come up with really amazing projects. Many of them now have COVID coordinators and focusing on really the direct response to COVID, such as prevention and testing and care, but also really looking at assessing and addressing the impact this pandemic has had on housing and jobs and nutrition. One of the community partners is refurbishing a gym to be able to provide childcare in that community because of COVID-19. So again, a lot of innovative responses, and we're really excited about this work in supporting our communities. Shifting gears, I want to touch on face coverings, which is so very important. We're going to first talk about the state fair. And many may be wondering, how can the state fair safely happen? The state fair has worked very closely with public health and Department of Agriculture and others to get a safe plan in place. And we are really impressed with what they have been able to come up with. So that includes, certainly they have canceled a number of events and activities, for example, some of the entertainment. They're also going to be regulating the numbers of individuals who can come into the state fair. But they've also done things like getting hand sanitizer in a variety of places, and will be ensuring that people who are not in the same household are social distancing, meaning they must be 6 feet or more apart. But also very, very important, and we thought it was important to make sure people know that this is the expectation, that because social distancing will be challenging at the state fair, that everyone will be required to wear a face covering while they are at the state fair. So let's talk about some new science around face coverings, which is really quite impressive. You may have heard probably 6 to 8 weeks ago, there were 2 hairstylists who were tested positive for COVID-19. And in looking at the time in which they were potentially infectious and exposing clients, it was identified that there were 139 clients that they had spent more than 15 minutes with and were less than 6 feet. I mean, if you think about it, and probably most everyone now has, in the last month or so, seen their barber, seen their hairstylist, and we know you are less than 6 feet away from your hairstylist. It's the only way it works, right? And what they found was none of these clients who had been exposed became positive. And this is because all the hairstylists in the salon, including the 2 hairstylists who were COVID positive, were wearing face coverings, and all of the clients in the setting were wearing face coverings. And this was really due to a local ordinance, and it really shows you how effective face coverings can be, and also how effective these local requirements for face coverings are. So we wanted to share that with you today because we think it's such important science, such an important finding. And with that, I can hand it back to the governor.
Thank you, Dr. Rattay. The data's in, the study's been done, face coverings work. And if you think about it, if we want our children to go back to school, and we do, for in-person instruction, then we all should make sure we're wearing face masks, because that's going to push the level of COVID-19 spread in our state down, in our community. It's going to protect vulnerable citizens, and it's going to put us in a position where we can educate our children safely. The idea of a child losing 3 or 4 months at the end of last year and a couple months or half a year this year in their education career, particularly if they're a 3rd grade or 4th grade, any age group, just really hard to wrap your head around. And so face coverings matter. On the White House call just yesterday, we heard from, again, the governors of Florida, of Texas, of Arizona, and other states who previously had not been as aggressively pushing face coverings, and they've seen the science as well. They know they have to do something in their states to contain the spread, and that's the most important thing that we can do. I went to a sporting events and into the YMCA last night, and I noticed particularly at the Y, many more people were wearing face coverings than previous trips to the Y. It made me feel a lot more comfortable. And for those of you who feel like you don't need to wear a face covering, or feel like it's uncomfortable under certain situations, think of bringing our children back to school so that they don't miss another day of in-person instruction. Face coverings work. Let's everybody wear them. And I heard that from the Vice President yesterday, and every member of the White House Task Force. AJ, can you give us an update on tests? Really good job there, and
Thank you.
continue to help us to flatten out this curve.
No, thank you, sir. And again, we'll lead off with testing here. So last week we had the exciting announcement that Public Health is working with Walgreens to expand our community testing. Just an update on that to start off. Due to the weather this week, this nice, desert lake and humidity lake weather we have, Walgreens is going to scale back their hours a little bit just for their safety of their staff and those going through those drive-through events, so about 9 to 1 each day. So we'll update that on the de.gov/gettested website, so you can check on that. But that's still not stopping any of the locations we have throughout the state of Newcastle, Kent, or Sussex County. Again, we have about 20 sites this week. We did a few yesterday. We're out again today, and we'll be out all week, and even having a few more evening sites. Again, can't stress this enough that we want to get people tested. We want to make sure people understand they do not need a prescription or a script from a doctor to get tested. Most of the state-sponsored sites, or actually all of them, have the opportunity to register in advance. So that website is found on the de.gov/gettested website. That should not stop somebody from stopping by if they have a few minutes and they leave work, or they're driving by. We usually have some capacity in there for walk-ups as well. As we're doing testing, I want to say, we're right now currently 13th in the country for testing per capita. So, while we want to make sure we identify those and isolate them if they're positive, we're right around this 5% point. It makes the governor's job a little bit more difficult when then we're testing and maybe we're getting over some of those thresholds that are putting us on lists from other states. But we know the best way we could make sure we stay safe is by getting people tested, both symptomatic and asymptomatic. So about 10 sites throughout Newcastle County for the remainder of this week. The governor said we were down at the back in Rehoboth today. Again, still getting a good turnout there. We saw a little lower turnout yesterday in Dover, and that could partially be due to the weather. I know Newcastle County had a little bit slower day as well, but as it cools up a little bit later this week, we hope to fill all these sites. So not only did we announce Walgreens last week, we're going to work with them to bring on additional stores in the upcoming weeks to make sure it's done in a way where we could manage the capacity at the public health laboratory. We're also looking at other ways to reach out to individuals. We know we have to have a foundation that's more than just one size fits all. We had a call this morning with our federally qualified healthcare partners and really had some great discussions about how we could get them to go in the communities for possibly those that are getting under tested as well. They've been instrumental at this point. We just want to make sure we're not leaving anybody out there without the ability to get tested. So again, de.gov/gettested has not only the state-sponsored sites, but the other clinics and facilities that offer testing throughout the week. Next thing, and I think it's a great segue from what Dr. Ortega was talking about, and I think we should be extremely proud of the work that our partners like the Delaware Community Foundation have done. The state's got limitations sometimes of what we could do and how quickly we could do it, and when it's partners like that step up to the table and build those relationships, that we're able to provide services to the citizens through a number of avenues. But what we'll be working on, I won't say for the next year, it's going to be the next several years, is really the cost recovery from COVID. So every state back in March was granted a federal disaster declaration and the Stafford Act disaster declaration, which provides us the ability to request 75% reimbursement for emergency protective measures. And so this isn't just for the state, this is for municipalities, fire companies, schools, hospitals, and other nonprofits. So we have 50 states and territories that are now going to be working with their counterparts in each of their FEMA regions to start putting these applications and these worksheets in. So we have over 50 applications or applicants. When that would be an individual fire company, that would be the city of Dover, that would be a hospital that we'll be working with. So we will have, like I said, years of work to go through and start to get some of that funding back that we're able to tap into. We have a team that is going to be committed to this. It's a huge part of the recovery because as we manage this, we have to make sure we look at the other federal funding that the state's been offered and supplied and make sure we put the right project to the right funding so we could maximize everything, so we make it a little bit easier for our state and our citizens. So we'll keep you up to date. We'll keep a dashboard of the obligated dollars that we're able to get back into the state. The other thing last week that Dr. Rattay mentioned was the testing guidance for business. So they put out a risk matrix out for different types of employees several months ago. We want to make sure that we have a conduit so employers could get to the Division of Small Business, DEMA, Public Health, to make sure they understand what their options are for testing their employees. So we have the survey tool up there to answer a few questions, gives us an opportunity to have some dialogue with people. We've had about 10 inquiries in the last week. We've got back to about half of those individuals, working on getting some information for the other ones, try to get those back within 3 or 4 days. Going to work on getting that time shrunken a little bit, but it's important as people are reoccupying the workplace. A lot of people have been working from home, which we know is safe, but sooner or later people are going to have to get back to their normal environment of what risks do they have, and it's more than just getting tested. It's how could you change that environment to make sure that it's as safe as possible. Same things that the school districts are going through right now to make sure people are getting ready to return to school. So there's a fact sheet on there that gives them guidance. There's also the how to kind of figure out who falls in what category, whether it's high risk, medium, or low risk. That can all be found on the reopening page of the coronavirus website. And last but not least, just because 2020 hasn't thrown enough at us, I want to make sure I hit our hurricane preparedness message again. Slide up here today is from the National Hurricane Center. There are currently, 2 systems that are in the Atlantic Basin and one in the Gulf of, almost in the Gulf of Mexico. We had a tropical storm warning just less than 2 weeks ago that popped up when a system came off the coast of North Carolina and Virginia. It's time to make sure we're ready. I mean, we have a very stressful year, I think, for everybody, and we can't let hurricane season go unprepared, and that's on everybody's level, from the state to our counties to our municipalities down to the citizen. People are fatigued. It's been a difficult year, but there's 3 things: make a plan, make a kit, and stay informed. Hurricanes are, it's coming up to the peak season for the Mid-Atlantic, August, September, October, where we'll see probably some storms heading up this way. It only takes one. We want to make sure people understand this. So whether it's a busy hurricane season or a slow hurricane season, it only takes one storm to change your life. And it's not even the storms I'm worried about sometimes. It could be that tropical system that we had 2 weeks ago, or tornadoes like we saw in Laurel last week. So, resiliency starts at the individual level. You can visit preparedde.org for more information. So that's it. I'll turn it back over to you.
So just to end with some good news, is that, AJ, something else to worry about during this unprecedented time of the COVID-19 pandemic? It's also hurricane season coming up, and we'll be ready. We'll be ready because of you and your team, AJ, and we got great partners there. One of the great things about our wonderful state is people really pull together when the chips are down, and we've been doing that over the last 4 months. We're going to continue to do it as we attempt to reopen the schools this fall and address any hurricanes that come our way during that period of time. So again, thank you all for joining us today. We've got some questions from the media. I see Meredith here. Thanks for being with us again.
Hello. I wanted to ask, of the kids who have been tested positive for COVID-19, is the data showing that Black and Hispanic children are being disproportionately affected like the adult population has shown?
Meredith, that's a great question. I don't have that answer right in front of me, but we will take a look at that and get back to you.
Okay.
What we do know is that in the adult population for Blacks and Hispanic, the result has not been like it has more severe in terms of deaths and hospitalizations, particularly with the Latino community, and that could be a function of demographics.
And there was a study published, I believe, yesterday by South Korean researchers showing that children between the ages of 10 and 17 were as likely to spread the virus as adults. I'm curious, when a decision comes down regarding in-school instruction, is it likely that younger kids might be in school while older kids aren't? Is there a split decision that could be a possibility?
Well, you heard me talk about my own view, which is the priority focused on the younger children for academic reasons. We obviously have public health objectives and we have educational objectives. And one of the things that has been kind of the highest educational objectives, as well as providing equitable resources for disadvantaged children, is to make sure that every third grader can read at grade level, right? And so that becomes a priority for us with respect to our educational objectives. And then we see the study, and we did see that study that indicates, and there have been other more anecdotal information about the severity and the small numbers of the younger children. Our own experience with the daycare population in the spring is that it seems like that's ought to be a priority and a focus for us. As to the science, I don't know on the.
Yeah, there are numerous studies that are showing that younger children are less likely to become infected and possibly less likely to spread. So, for example, one study that looked at kids in households was suggesting that most kids that were getting sick from adult household members, but they weren't spreading it to others. We still have a lot to learn. A lot of, certainly in the United States and across the world, during much of this pandemic, kids have not been in schools. But nonetheless, it does appear that maybe kids are not as good at aerosolizing or spreading the droplets as those, 11 and older.
And when it comes to percent positive, that data point with the school guidance, is that looking at the 5-day average, or is that specific to demographics in terms of, again, that 10 to 17 or 5 to 17-year-old school age range?
No, it's looking at it's looking at the community, right? So the idea is to measure, and I'll ask for Dr. Rattay's help here, to measure the amount of community spread. That includes everybody, right? And to try to get it to a level that's under control and manageable so that everybody's at lower risk, right? It's not just for those students in terms of the gating criteria.
Yeah, so, as we've talked about a lot, we feel so strongly, and I think our experience has really supported that you can't just look at one indicator. We're looking closely at case rates, we're looking closely at percent positive, and also, as the governor has talked about a lot, hospitalizations are a good indicator of the acuity or the severity of what's going on in the community. Now, we have been using a 5-day rolling average on our My Healthy Community website. We're seeing a lot more that, whether it's CDC, other states, others, are using a 7-day average. So we're going to start making that available as well for, to benchmark, to compare. But, we believe it's important to look at multiple indicators and also not to look at just any one day because, things tend to go up and down.
And this is my last question, but I wanted to, Delaware is back on New Jersey and New York's travel advisory quarantine list, and Governor, I wanted to see if you wanted to react to that.
Yeah, I'm mad
decision.
as hell, frankly. And it doesn't make any sense. And it doesn't make any sense. Could we put up the chart that shows the new positives? Basically, we have 2 days. First of all, we're in a better position, percent positives, and you knew you were going to set me off, and you're just going to sit down and let me answer. Then watch it happen. So here's our 5-day moving average on new cases per day. Actually, New Jersey, New York, and Connecticut use a 7-day moving average, but it's 105. Our target's like 97. So we're right. As I said to Governor Murphy and Governor Cuomo last week, we're going to be on and off unless we stop testing, and we're not going to stop testing. We're going to test. Particularly, we're going to focus on testing where we think that we have an outbreak. At the same time, we have a percent positive that's 4.2% positive, which is below the World Health Organization, better than the other states in our region, not New Jersey and New York, in fairness to them, but certainly better than Pennsylvania, who's not on the list because they don't meet the criteria for new cases per day. Let's show the graph, and you can see the up and down new cases per day. And we've got basically 2 days that set us back. So not on the 90-day. Go to there we go, in the top far right, I think it would be. Can you do that or no? To just go on to one of the indicators which shows the number of cases and the percent positive, or so this is a copy. So if you went to that chart on our Healthy Delaware, Healthy Community on the de.gov/coronavirus, you would see that there are a couple days. It's on the bottom left. Bottom left. You can see 2 days. One is July the 16th, and one is yesterday, that are over 100 cases per day, which push us above the criteria. That makes no sense. And we're better today than we were when we were first put on the list 2 weeks ago, and we're better today than we were last week when we were taken off the list. So we shouldn't be on the list, and I've made it clear. I've already contacted Governor Wolf. He understands my point of view, and he's going to raise. It's on automatic pilot with his public health people, where it just triggers some sort of recognition, and it should be a more thoughtful process than that.
All right, first question's from Melissa Steele at Cape Gazette. She asked, New Jersey has allowed practice to start for high school fall sports. Will Delaware be following soon? And we had a similar question. What factors, besides the opening of the schools, do you feel are most important when it comes to their being able to compete or not next month?
So this is the New Jersey that just put us on the quarantine list, that's having people practice football out there, which doesn't make any sense to me as a former football player. But DIAA and their folks are looking at that question. I think they have a meeting tomorrow. We saw this week, or last week, that the Colonial Conference of the University of Delaware has suspended fall sports. Ivy League did it a week or so before that. And so they're not going to play fall football, maybe in the spring. And so we'll look at that question. I think we'll make an informed decision based on the health of the community on the ground and the level of close contact interaction with players on the field. And again, having played high school and college football, I just don't see how you can do that in a safe way unless you put everybody with shields on and lots of other precautions. That would be difficult to do.
The next question's from Sophia Schmidt at Delaware Public Media. Counties in Maryland are urging the state to renew certain restrictions after they've had a spike in cases. You've had some trouble coordinating with Maryland on reopening beaches. Are you concerned about the outbreak in their state, and are you willing to work with Governor Hogan?
Certainly willing to work with Governor Hogan. He's the chair of our National Governors Association. This meet. He's done a great job, by the way, of leading that organization and really representing all the governors and our needs and our priorities, both before the White House Task Force on the coronavirus, as well as with interactions with the Trump administration, Secretary Mnuchin, over more flexibility in using CARES Act funding. He's been a good partner for us. The problem with respect to the beaches is he has allowed the beaches, in Ocean City in particular, to make decisions, locally, and those decisions have collided with some of the things that we've been doing at the beaches. I think if you compare the two, our approach demonstrates is a demonstration that that what we've been doing is working, and that theirs not so much. They've had restaurants that have had to close completely because of outbreaks among their workers. I think at one level you just have to be honest about what's happening, particularly with respect to venues that we know are challenging, bars and restaurants. And if you're seeing outbreaks, it's actually the evidence is there with people who work in restaurants and bars and who've tested positive for COVID-19, and they've indicated that they've been in these places, or they've got friends and they live with folks that work in restaurants and bars, then it just makes sense that you've got to be more cautious there. And but I think the answer is those decisions are not being made necessarily by Governor Hogan. He's been a good partner with respect to NGA and other things that when we've had to call.
The next question's from Sophia Schmidt at Delaware Public Media. Brandywine School Board voted last night to delay the start of school so the district will have more time to plan. And the statewide teachers union has expressed concern about districts having time to reopen and supports a remote start to the school year. Is the state having any second thoughts on its approach?
Yeah, so we've come up with the guidance to the school districts, and it was a very thoughtful process, lots of people involved in it, including the teachers. We're fully aware of the need to open and open safely. It's going to be based on the facts, the data, and the situation on the ground. The percent positive COVID-19 cases, the day-to-day positive COVID-19 cases, any spikes that we might see in different geographic areas, hospitalizations, i.e. the severity of the illness in our state, and really a kind of scientific approach to what is the amount of community spread of COVID-19 here in Delaware. It's not going to be based on fear, and it's going to be based on also the logistics and operational challenges of the schools. Clearly, that's got to be factored in. We're going to work very closely with the schools to try to get as much in-person instruction as possible. Might it make sense for schools to gradually open and learn as each day goes by? Certainly, if that's what it takes to make the appropriate accommodations. And so, with respect to our goal to test every teacher and staff member, a goal, having schools and districts open in a staggered kind of way, maybe a week apart or a few days apart, actually helps us in getting tests done and processed in a timely basis, so you're not losing time, so you're making a contact with anybody who tests positive in terms of contact tracing, and to make decision based on those interviews about what may or may not be happening in a community. And so it's going to be based on a lot of data and science and whether or not it's safe to do so, and whether or not each school district and each school has a plan to keep everybody safe while really making an effort to get as much in-person instruction as possible.
All right, we have two more questions. This one's from Sophia Schmidt at Delaware Public Media. Can you give an update on the state of the outbreak in the poultry worker communities in Sussex?
Yeah, I look at that quite a bit myself. So I look on my community health, part of our de.gov/coronavirus. Other than the initial outbreak and the number of cases there, we haven't seen an uptick in the number of cases. We haven't heard that I'm aware of, and I'm going to ask Dr. Rattay, from the contact tracers about that. We've not heard from the hospitals. We haven't seen an uptick in hospitalizations. We haven't heard from the union representing those employees or the plant managers recently. Haven't heard from the Department of Agriculture. So there are lots of different points from which we might have gotten that information, and we've not heard anything. I'm hopeful that I know our efforts were one of the more notable things, responses that we've had over the last 4 months, testing thousands of workers in the plants, testing thousands of family members and residents in the communities in Georgetown and Seaford and Millsboro and Towns, Milford, across Lower Kent and Sussex County. We've tested more intensely in those communities than anywhere else in our state. We put more effort into it at the community level than anywhere else in our state. And I feel like we've been able to flatten that curve. And And if you look at the data, back to Meredith's question a while ago, we didn't have a lot of fatalities within that community and that demographic. Fair number of hospitalizations for sure, but we've not seen much since then. What we've seen is the uptick among a young adult crowd in the beach areas. So is that the last question?
Just one more.
One more question.
The last one's from Tom Lehman at WBOC. Some groups like the Wyoming Peach Festival and organizers for another event in Bowers say they were denied being able to hold their events by the state. Some have raised the question with equity over the fact that the state fair is moving forward. Can you offer any details about the decision-making process?
Yeah, so I'll ask Dr. Rattay, because Jamie Mack, who works for her, does a lot of this analysis on the front end, and a lot of it has to do with the ability to control the environment in which the event occurs. And so a parade, for instance, to take one of the examples, which is part of the Peach Festival, not the whole part, involves people congregating kind of shoulder to shoulder mostly along the street. It's a wonderful parade, by the way. I love it. Usually it's pretty hot. It's in the morning normally, but folks are pretty close together. And you don't really have monitors or folks that could keep people separate. The state fair, on the other hand, it's over a week and a half, so it's spread out a lot. I know that lots of the large events have been canceled. A lot of the events at the state fair are outside. They can be moved outside. I think if you think about what the state fair is going to be this year, it's going to be more look like, a 4-H gathering with displays and with that type of thing, with people, spread out, lots of outdoor locations, lots of management by the fair staff, and staff for the 4-H 4-H volunteers and those that work with the children, and of course the farm community that gathers in the pavilions as well, which even in a regular year are pretty spread out and controlled. So that's a big part of it. I don't know if Dr. Rattay wants to add anything to that.
I don't. I think that was, exactly the thinking of our team. It's just very difficult to control the environment when you can't control who comes in, how many come in, or, ask people to leave in those kinds of large events in public settings. So it's a very different type of event.
So again, as we finish up here today, I'm asking all the folks across our state again to recognize that we're all in this together. If we want our children to go back to school for in-person instruction, that we'll take measures today to protect the health of the community and the amount of community spread of COVID-19 that will exist a month and a half from now. So it requires us to act with a sense of community, to be smart. Just take really simple measures. Wear a mask when you're in public to protect yourself and others, mostly protecting others. Again, sanitize and wash your hands awfully often. Wearing that face mask, I think, is the most important thing you can do. So we talked about on the White House conference call yesterday, from the Vice President down, wear face masks, wear face coverings, and keep social distance. So all these states that are experiencing outbreaks, that's their primary and fundamental message, as well as closing down bars and restaurants and places where people congregate in a way that's not safe for the spread of the virus. If we're able to do that, we'll be able to push those percent positive rates strongly below 5%. We're in the 4% range right now, to push those new positive cases per day below 97, below the mid-50s in Newcastle County. And if we're able to do that, we'll be able to reopen different sectors more broadly, to reopen our schools and to do it safely, and frankly, to go back to a more normal way of living as with the same protections, with face coverings and social distancing. So thank you for helping us make so much progress over the last 4 months, and we look forward to continue to make that progress and push those numbers down even further. Thank you very much, and we'll see you next week.